tomorrow?
Yep, it'll go out tomorrow.
Okay. A couple things coming up at CNM I want to make sure that you are aware of. On the 28th, next week, we are having a workshop, Understanding Identity and Unconscious Bias. And that's with Amy Sadler. And she's part of People 3. And then on the 29th, we have one of our most popular facilitators, Deb Palmer George, talking about the art of leadership in a workshop. On the 30th, next Friday, we have community conversations, and that's through our Community Impact and Equity Initiatives department that is run by Dawn Stone. And this will be at LGBTQ plus conversation on intersectionality and race with Phil Cabucci, the LGBTQ Chamber and National Pride. So it'll be a very interesting conversation. That's free. Just go to our workshop on the website and you can sign up for that. And then on the 5th of August, we're going to be talking about in a workshop, barriers to organizational change. And that's facilitated by John Thalmeyer. And then on the 11th of August, our CEO conversation will be about how CEOs can promote healthy growth through effective communication. So that's some of our upcoming events. Last year, during the beginning and into the middle of the pandemic, CNM created some needs assessment surveys that we sent out over periods of over some months. We did 2 or 3 of those last year to our members so that we could be sure to assess and then address needs during the pandemic. And that allowed us to really modify our programming and pivot our resources to meet the members' needs. And so we just did one again in June and July and have some of those results ready to share with you today. It was a short survey intended to not only capture needs, but also data and stories on the sector that will serve as a historical record during the things we've all been through this last year plus. We received more than 150 responses, and 85% of those responses were completed by CNM members. We sent it to members and non-members. 60% of the participants identified as executive leadership. We have over 700 member agencies this year at CNM, and so we realized that the voices that were characterized in our survey are just a sample of our total number, yet they tell us a great deal about how the sector is feeling as a whole. Over 80% of our respondents currently don't work with a lobbyist, but would like to learn more about policy and advocacy. I'm sharing some of the highlights. This is the first highlight. And the top 3 most used member benefits were identified as our job board, member discounts on our workshops, and of course, Salute to Excellence Awards. And then as CNM prepares to launch a nonprofit compensation study, so that's probably the phone call we get the most often, is we need help figuring out how we should pay people. And we have one in the works. So as we begin to prepare to launch that, some of the requests that we were asked for by survey respondents were salary info by title and role in the organization, Middle Tennessee nonprofit salaries benchmarked with other markets, and then salary information by service area. And as we continue to evolve our educational workshops, over 80% of our respondents say they would prefer half-day workshops to full day. And, we've been doing even shorter than that when we do virtual, with 55% preferring virtual training and 45% preferring in person. And I think we got a lot of commentary there, like, I would come to in person, but it kind of depends on the topic. So there's a lot to tease through there, but overall, that's what the percentages look like. And then another interesting slide was about, this slide is about office space needs, because again, who's not thinking about their office space needs? A lot of us are still in virtual, some are doing hybrid spaces. We learned that 53% of respondents are looking to share or rent their extra space and or downsize. 25%, though, are looking to expand their office space. So I guess I just want to say we're still combing through this and teasing out what it means and what it says, but we really appreciate everyone who took the time to fill out the survey. we know your time is valuable, and we know it took a few minutes to do that. So thank you so much and we will begin implementing your feedback right away as soon as fourth quarter, maybe sooner on some of the things. Here's excitement. We did promise all respondents the opportunity to win one of 3 $100 Amazon gift cards. So drum roll, let us congratulate Vladimir Enlow with You Have the Power, Karen Gillingham with the New Beginning Center, and Tom Starling, Mental Health America of the Mid-South. Congratulations to our gift card winners, and congratulations to everybody for helping us with information that will make us able to serve you better. So if you're a winner and you're on the call today, you should have an email from Chelsea Harden, who is with us today, and she'll give you directions on how to claim your gift card. So actually, the reason that we picked this topic today is because some of the other questions that I didn't necessarily mention in the PowerPoint had to do with the returning to the office and safety precautions and all sorts of things. And so that's how we selected our amazing panelists today. You know, COVID-19 introduced nonprofits to really unique challenges as we tried to keep virtual and hybrid teams motivated, engaged, and connected. And as we reimagine our workplaces in a post-pandemic world, we really have to consider how the workforce landscape has changed, what new policies and procedures we need to evaluate, and how organizations can protect and care for our employees. We just began our return to office transition this week with an in-person staff meeting, first time in a really, really long time. It was so good to see everybody, but we're excited to have the opportunity to learn and grow with you all today. So let's get started with our 3 fantastic panelists today, all from Hub International. First, I'm pleased to introduce Carrie Chavini, Esquire, Senior Vice President, Strategic Client Solutions, South Region at Hub International. Carrie has 20 years of combined experience in employee relations, human resources, employment law litigation, and employee benefits legal guidance. She works closely with clients to identify compliance risks across the organization and develop responsive strategies and solutions that ensure compliance and further the overall organization's goals. She holds a BA and an MA in speech communication from the University of South Florida and a law degree, Juris Doctor from Stetson College of Law. Welcome, Carrie. Our next speaker is Rob Santel, Director of Social Services at Hub International. He has spent the last 12 years working and consulting with nonprofit organizations of all sizes, and I bet many of you know Rob because he's worked with lots of our nonprofits in this area. As Director of the Social Services Unit, his role is to understand an organization's needs and develop strategies focused on protecting employees, clients, and their assets. His current client base includes more than 250 nonprofit organizations in and around Middle Tennessee, as I said. He holds a bachelor's degree in communications from MTSU and is also a certified insurance counselor. And finally, please welcome Shannon Crawford Csp. Shannon is Senior Risk Services Consultant at Hub International, and he's worked as a risk management consultant, an insurance broker, and an OSHA compliance supervisor. Shannon assists clients with controlling losses and promoting and maintaining safety within their organization. Shannon holds a bachelor's degree in occupational safety and health from Murray State University, has extensive knowledge of OSHA policies, and is an authorized OSHA trainer. So we are really excited to have these fabulous panelists with us today from Hub International. And as a reminder, if you have any questions for the panelists, add them to the chat. We'll do our very best to get them answered, and we are hoping for time at the end for some live Q&A. Our first topic, we took the topic of navigating a post-pandemic workforce and we broke it down into 4 sections, including vaccine considerations, PPE, workplace safety, and leadership. So our first section, we're kicking off vaccines, safety, and PPE. In nonprofit HR's 2021 Return to Work survey, 85% of respondents noted that mitigating health risks for staff was a top concern for their leadership. How do you compare this with what you have seen in other research? What suggestions would you make to nonprofit leaders on how they can protect their employees moving forward?
So, hi everybody. Terry, thanks for the very generous introduction. I often don't recognize myself in those introductions. And hi to my friends on the call. You've chatted me, and yay, it's so nice to hear from Hub clients and Hub friends. I'm going to ask Shannon to weigh in on number one right along with me with respect to returning to work, mitigating health risks, and all of those sorts of things. I find your survey especially fascinating with respect to office space going forward. I can tell you that for those of you who don't know the Hub footprint, we are an international brokerage. We have offices in Canada, Puerto Rico, and in the United States, and we're asking ourselves the very same questions that you guys are asking yourselves. And that is, do we bring people back? How do we bring people back? How do we keep people safe? And how do we also address some of the personal changes that have happened in people's lives and be sensitive to the permanency of some of those changes? And we'll get to that later on in the program. So I think I'm going to punt it over to Shannon to talk about mitigating some of the risks, because he is our OSHA guru and expert, and then I can weigh in as we get deeper into this topic on vaccines and those sorts of things.
Yeah, thanks, Carrie. Hello, everyone. Good to see everybody. I do have a few notes up here. It's a lot for me to remember, so if you see me looking up in the sky, it's I'm referring to my notes. But good to see everyone. Thanks for the question. Yeah, so big challenges, like Carrie said, getting back to the office. What do we do? How do we handle that in any workspace, for that matter? We've seen a lot of controls. I mean, we've all seen that, right? We go to Walmart or Lowe's or wherever, we see people with controls. So it's going to be the same for us, right, when we go back. How do we mitigate these hazards to our employees? Currently, OSHA does not have, they like writing standards. They don't have one specific to what most of you folks do. There is an emergency standard for the medical field. Doesn't apply to what you guys do for the most part, I would say, but just know that is out there. So, Carrie, I thought that would be one reference they could use to, okay, it's not going to necessarily apply to us specifically, but as a guide, a platform to start from. And then just the OSHA website itself has it's more than I can cover here, but basically a step-by-step for all other employers guidance. There's no requirements in that. They're just suggestions or recommendations that OSHA makes. So that's at osha.gov, and it's the very first thing that'll pop up. You'll see it. I think it's COVID help for all employers or something like that. So it's a good resource for folks on the call. You just go through and see how it applies. And the main thing it starts with is having a plan, how we're going to do it, and then tailoring that plan to your specific exposures. And then there's specifics it goes through as well. So that'll be my main starting point for that, getting back to work.
And I think I'll coattail on Shannon's answer and remind you guys that COVID is COVID and people are people and the virus is the virus. So one of the things that I see employers really sort of miss on is creating risk mitigation and health and safety policies that apply to everyone: visitors, clients, customers, employees. People are people, virus is virus. It doesn't make any difference. So it may feel odd or uncomfortable to say to a third party, we have standards of conduct that apply to you, even though you're not our employee. But if you're focused on health and safety, it doesn't make a difference where the relationship resides, right? The other mistake I see very often is, well, the employee has a positive person at home as opposed to being exposed to somebody at an event. I've seen this a lot all of a sudden. It doesn't matter where the exposure occurs, right? If you're exposed, you're exposed. It doesn't matter if it's a son, a person in line at the grocery store, or your partner, or your spouse.
That's a good point. That's a good point, Carrie. It applies, like you said, it applies to everyone. And OSHA kind of stepped out of what they normally do with the employer-employee relationship here, and they made some recommendations on customers coming into your place or vendors or whatever. So they've addressed some of that as well.
All right. Well, thank you for that. So Our mantra has always been to try to be as flexible as possible without impacting our organization's performance, and that is being tested as we in this whole environment. But when it comes to safety and vaccinations, may an employer require all employees physically entering the workplace to be vaccinated for COVID-19? What would some of the possible consequences be for taking this stance?
So it's a great question. And what's super interesting is January, February, March, first quarter of this year, the conversations that I was having with clients were much more around education, what I'll call the motivation conversations, right? You can mandate, you can motivate, you can educate. And the conversations that I've been having were very education, very motivation driven, I'd say for the first half of the year. Employers really almost consistently took the position that we're going to let employees make their own choices. And we hope that through people making their own independent choices, we will get to herd immunity. We will get to some level of increased safety in the workplace without having to have the difficult conversation around mandating the vaccine. That conversation's changing and changing rapidly. I have a number of clients who have made the decision because they didn't see the traction around vaccinated workforce. They've made the decision to mandate the vaccine between now and the end of the year. Employers can mandate the vaccine, and here's a few myths that I want to dispel. The first myth is employers can't mandate the vaccine because it's emergency use authorization only. There were 5 lawsuits that were filed on this theory of law that I know of. There may be more now. I haven't looked in like, a minute, and a minute in COVID time is like 6 months. But there were 5 lawsuits filed. The district court in the state of Texas ruled on one of those cases and said emergency use authorization does not delegitimize the vaccine itself, nor does it interfere with an employer's right or ability to mandate the vaccine in the workplace, and threw the case out. Now, there's cases in New York and New Mexico and North Carolina, and we'll see if those jurisdictions land on the same side of the fence as Texas. But so far, based on that Texas court ruling, emergency use authorization does not impede an employer's ability to mandate the vaccine. The next myth is, well, you can't mandate the vaccine because it's discriminatory. It's a violation of HIPAA. It's a violation of some employment-related work rule or law, and that's just simply not the case. If you go to the FAQs for the EEOC has been updating a COVID-related set of FAQs. There's a couple of hundred of them now, and you go to the K section, and the K section of the EEOC FAQs talks exclusively and entirely about vaccines and an employer's right to mandate the vaccine. An employer can mandate the vaccine so long as, and this is super, super important, they make an accommodation either for people with sincerely held religious beliefs that conflict with receiving vaccines, or people with qualifying medical conditions under the ADA that require an accommodation. So if you have a qualified medical condition, a condition that qualifies as a disability under the Americans with Disabilities Act, you must engage in the interactive process and identify an accommodation for that employee. Yes, that is the link. Thank you, Catherine. You rock. Yeah, your like research skills are on it. I'm watching you post links. I'm like, yes. So as an employer, if you choose to go down the path of mandate, you must make accommodations for religion. You must make accommodations for medical conditions. You are entitled to documentation to substantiate the legitimacy of the medical condition and the inability to be vaccinated because of the medical condition. If you do not believe, based on legitimate, documented evidence, that the religion is a sincerely held religious belief, you may ask for documentation for that as well. But your right to documentation under religion is far more limited, and the EEOC takes the position that you should give the employee the benefit of the doubt that it is a sincerely held religious belief, unless you have some legitimate evidence to the contrary. Simply being skeptical is not enough to avoid your obligations to engage in the interactive process for religion. When we get to handbooks, we'll talk about this, but all this needs to be memorialized in a process communicated to employees. And we don't want to forget about your candidates. Candidates for employment have the same rights as employees when it comes to these accommodations.
All right, Carrie, thank you. That's so helpful. So you talked about motivating and educating. We know that it's important for employers to employ some strategies to encourage their staff to become vaccinated. Do you have anything further to say on that subject?
So, I've been having a lot of these conversations, both internally with Hub as the employer, and externally with clients. And I think that I really like the education and the motivation approach, right? The more employees have the opportunity to make these very important decisions, I think the better for morale, the better for people's state of mind. I think this is just the world according to Garp, guys. This is just my 2 cents, but I'm not sure that employers want to be in a position of forcing people to take this vaccine. There's just too much stuff going on around the vaccine. Having said that, I think one of the ways to help people make those free choices on their own and be part of the decision and part of the solution is to ensure that they're hearing from people who are like them, people who are part of their communities, whether it's elected community leaders, healthcare professionals in their communities, elected officials, maybe. We all have different opinions of elected officials, right? Religious leaders. But I think people who are part of the community in which you belong, to which you identify, who can provide good, legitimate, factual information, because there is so much misunderstanding. The CDC has some really, really great information sheets. They even have a page that's just dedicated to the myths and the misunderstandings about the vaccine. But I know a lot of people don't necessarily have faith in the CDC, which is why I say I think this is the time to go local. This is the time to go to people in your community who can provide good information, be a resource, help people overcome concerns, or help them simply get to a decision that's right for their life and their lifestyle.
Yeah, great. That's really helpful. So stepping down from vaccines a little bit, let's talk about, can an employer require returning to the office workers to wear personal protective gear and engage in infection control practices? What type of documentation would they need for an exemption there?
Yeah, I'll take that and I'll let Carrie jump in too. So yes, they can. It's no different than it's ever been. If I was employed and required safety glasses at my workplace, you can require safety, but that's not changed for this. So if you as an employer, one thing OSHA likes, well, it's actually kind of a requirement actually, employers to do is do a PPE assessment. So any kind of personal protective equipment an employer is going to wear. Of course, in this case, we're probably thinking more respirators and things like that for the aerosol hazard. But they like you to do an assessment. And if your assessment says my employees need PPE, then they're required to wear it. That's just, and you can discipline employees for not doing that. As far as PPE and face coverings and respirators and all, there is some confusion there. Again, a lot more we could probably dig into right now, but one thing OSHA does recommend right now, and this is not a requirement, they do recommend face coverings for unvaccinated workers and those at risk. And then CDC also provides guidance on that as well. You can look on their website for that guidance. Again, this is a recommendation, and what we're talking about here is not necessarily like what we would consider a respirator with cartridges. You may have seen, if you've seen those or not, but face coverings like the medical mask, the homemade face coverings people make, that's what they're talking about here. Isn't really considered PPE from traditional OSHA standpoint, but they do recommend that you provide those or encourage those for unvaccinated workers. And again, it's not a requirement, but it's a recommendation for them. Another recommendation OSHA makes is supporting those that choose to wear face coverings. So if you don't have that rule in your workplace and there's employees that want to do that, just support that. Don't hinder them from doing that. Again, another recommendation from OSHA. Now, and again, the difference between face coverings and true respirator, then we get into an actual PPE standard, personal protective equipment standard per OSHA. If your assessment says my employee needs And that's mainly for folks, if you'll see in that emergency medical field standard that they came out for COVID, there are requirements in there that say they have to wear a respirator, health screenings, the PPE assessment, written programs, and all that. So I told you a lot more than you asked, but I think it's good to cover that there's a lot involved when you start talking about face coverings, PPE, respirators, all of that. So the original question, yes, they can be required to wear PPE if it's needed. And as far as documentation, I don't know of any that's required. That's where I was going to let Carrie jump in. I don't know of any documentation that they would. I'm not saying it's not a good idea for this exemption, but I don't know of anything from an OSHA standpoint where there's documentation required from the employer. So Carrie, you got any input?
Yeah, I have a whole bunch of thoughts, as you guys can imagine. So I'm going to hit the exemption, and then I'm going to go backwards and talk about vaccinated versus unvaccinated, because Shannon, you brought up a really good point, and it is probably one of the top questions that I field on a pretty regular basis. So with respect to an exemption, let's say that you have a mask mandate in your workplace, and you've got an employee who raises their hand and says, I have asthma, or I'm claustrophobic. And I'll tell you, I'm claustrophobic, and my better half, I'm surrounded by OSHA people, and my better half is also an OSHA health and safety officer. And he said, start wearing your mask, a minute a day, 2 minutes a day. And now I wear it. I mean, I did a flight to Wyoming and wore my mask the whole time. And I was so proud of myself that I didn't freak out wearing it. But you're going to have employees who have issues like this, right? Especially the asthmatic employees. And this is the same conversation that you're going to have around a vaccine mandate and an underlying health condition under the ADA. A qualified health condition under the ADA, whatever it may be, requires that you enter into the interactive process to identify a workplace accommodation. Can you build a partition or barrier around the employee in their cube? Can you put them in an office? Can you put up plexiglass walls? What are the things that you can do to keep that employee safe and mitigate the risk associated with not wearing a mask in the workplace? You can ask for underlying documentation to substantiate and legitimize the inability to wear that mask if there is a mask mandate in your workplace. From a to mask or not to mask approach or perspective, or to face covering or not face covering perspective, this goes hand in hand with the vaccine conversation. So the CDC has come out and is increasingly coming out with more and more guidance that differentiates between vaccinated and unvaccinated workers. Even with the Delta variant, what they're finding with the Delta variant is even those who are vaccinated that are getting COVID are not getting nearly as sick as those who are not vaccinated. So the CDC is continuing to refine and provide more and more guidance for those who are vaccinated versus not vaccinated. And so employers are left scratching their head saying, what do I do? Do I make everybody wear a mask? Do I make only those vaccinated not wear a mask and those who are vaccinated wear a mask? And if I say, okay, those who are vaccinated don't have to wear a mask and those who are not vaccinated must wear a mask, am I going to start gathering vaccine information? If I'm going to start gathering vaccine information, am I going to walk around with my little clipboard and say, Bob, I see on my list that you're not vaccinated, you're not wearing a mask, I'm writing you up. And hey, Sally, good for you, you're vaccinated, thanks for wearing a mask. You're going to turn into the mask police. And I have clients falling all over the spectrum on this. What I see most common though, is employers are really relying on the honor system and saying to employees, it's kind of your hybrid solution. If you're vaccinated, you do not have to wear a mask, but we encourage you to wear one anyway if you would like to. If you're not vaccinated, you must wear a mask. We are relying on the honor system, but if we learn that you're not vaccinated and you lied to us, or if we learn that you're not vaccinated and you're not wearing a mask, understand that we have standards of conduct and discipline, and there will be consequences for lying and consequences for breaking work rules. People are pretty bold on Facebook, so you might know more about your employees if you want to know.
That is true. This leads, I think, really nicely into our second topic, which is employee handbook and policies. And so I'm going to combine a couple of the first two questions, I think. What logistical considerations should employers consider when preparing for the physical return to the workplace? And in tandem, what policies need to be updated as employees return to work? And are there any resources that you guys can share with us? Because we love to take a template and make it our own.
So I'm going to start with the easiest one first, and that is the resources. I have a document that I created last summer, and I actually put my eyeballs on it this week in anticipation of this question to see if I needed to dust it off and update it, and it's still actually in good shape. Unlike everything else I developed last summer that has to be completely redone. But it is a handbook considerations document. I think it's like 8 or 10 pages, but I'll get that over to the group so that you can distribute it. A couple of thoughts, and I think Shannon, you touched on it really nicely. These safety protocols that we're talking about, these work rules that we're talking about, they are standards of conduct. They are behavioral expectations of your employees, just like expecting them to wear their safety glasses or their steel toe boots or their hard hat, or not using profanity in the workplace, or not punching somebody in the face, or not wearing revealing clothing, or whatever your work rules are. COVID health and safety work rules and standards of conduct are just like anything else. So as you look at your employee handbooks and you look at the rules of engagement for returning, have you been clear about your expectations and the consequences for failure to follow? There's a client on the phone right now, and she knows who she is. And last year we did a year-long segmented workshop training, and one of the trainings was around discipline, performance management, and accountability and employee feedback. And one of the points that I made in that training, and I make all the time, is you have to hold your people accountable. If you are bringing employees back into your workplace, do you have written clear policies, and are you prepared to enforce them? If you are not prepared to enforce your policies, do not bring people back into the workplace. If you are not prepared to write up people and fire them for violating your safety rules and your COVID rules, then you are not prepared to bring people back to the workplace. You have to have safety rules and you have to enforce them. Other things to think about, I talked a lot about ADA and religion and asking for accommodations. Are those policies buttoned up? If I sit down and look at your ADA accommodation policy or your Title VII religious discrimination accommodation policy, do I know where to go? Do I know who to talk to? Do I know how to get to them? How do I ask for an accommodation? And keep in mind that the courts have been very clear that you cannot require requests in writing. Sometimes you have people who can't write English well. Sometimes you have people who have illiteracy issues. Sometimes people just feel uncomfortable putting stuff in writing. So you have to give multiple avenues for people to be able to raise their hand and say, hey, wait a minute, what about me? I need some help. And the more accessible your HR folks can be, the better position you are in being able to be responsive and address those concerns. Shannon, what did I miss with respect to policies and documentation and that sort of thing?
You never miss anything, Carrie. You're right on. No, it was good. Good stuff.
Well, with 47% of our respondents to the survey told us they had 5 employees or less, and that they're operating heavily on volunteer efforts. So are there any additional policies or procedures you'd recommend adding for non-paid staff?
It's very rare that the following is going to come out of my mouth. It's even hard to say. I'm always very sensitive to ensuring that in substance, you don't accidentally convert a volunteer to an employee by imposing policy, process, or protocols. I did not do that on purpose. It just happened. Policy, process, or protocols to volunteers or non-employees in such a way that it makes them look and feel like an employee. If it walks like a duck and talks like a duck, it's a duck. If it walks like an employee, talks like an employee, it's an employee. But here, when it comes to managing the COVID risk, this goes back to what we said before. People are people, the virus is virus, transmission is transmission. So whether you're talking about the Federal Express person, the copy machine person, the Coke machine person or a volunteer, you have an obligation to provide a safe working environment, right? Shannon, OSHA general duty clause, got to provide a safe working environment. That would extend to safety protocols that apply to third parties. Shannon, what do you think about that?
I mean, I think I mentioned earlier, it's just a little different for OSHA. I mean, it's always been that employer-employee relationships, what they hung their hat on. It is a little different here because you have a hazard potentially being brought into the workplace. And I think that's where they would go. And that's my opinion there, but I think that's where they would go is there's a recognized hazard here and you didn't do anything about it. That's my opinion.
Yeah, no, I
Can I add
agree
something
with
here
you.
too?
Yeah, go ahead, Rob.
Well,
Please.
from a standpoint of what we've always told our organizations in regards to volunteers, you treat them differently based on their level of engagement. If you have a volunteer who is has direct access to clients, you can take care of them one way. If you have a volunteer who's just coming to stripe your parking lot, you can handle them a different way. So there's some freedom in those situations. So.
That's interesting. That's really interesting. Well, so especially during the thick of things with the pandemic, we saw businesses and organizations handle these kinds of policies really professionally and also inappropriately. And in the middle of all these COVID concerns, how do we, so let's say a volunteer comes in and doesn't like whatever it is we're asking them to do. I don't have to wear a mask anywhere else I go. So, and it gets a little heated. What are some processes or steps that we can consider to de-escalate that situation? Because often we're asking our, frontline employees they're sort of the first line of defense sometimes here. So help us with that.
So Shannon, I'm going to go to you first because this feels very much like a avoiding workplace violence kinds of things, and then I'll weigh in with anything I might have to say, which may not be as much as you.
I was going to defer to you. I don't have a fantastic answer for this. I mean, I think it gets kind of outside the scope of what I've had dealt with. I mean, it's always been, from an OSHA standpoint, it's heavily driven by employees and, real employees and less volunteers. And
so here's my suggestion and advice to you guys. And I know that
this could be vendors, this could be anybody that isn't, could even be an employee.
A couple of thoughts. The first is that I know that we're dealing with nonprofit organizations who have limited resources and limited funds, especially on the heels of COVID. I know that donations have been down, fundraisers have been down. This is crisis financially for many, many nonprofits, and I really appreciate that. There are organizations and people out there who would be willing to donate services, police forces, for example, in communities where they're not strapped with other kinds of crises, who will provide this exact kind of training. We have a client up in Tallahassee, it's a community college, and the police department, the local police department in Tallahassee goes on campus once a year and teaches de-escalation tactics and strategies and approaches for potential confrontational workplace, school-based conflicts and confrontations. With respect to vendors who are sending their employees on your site, there is absolutely nothing wrong with, oh, thank you, that is great. That webinar is by Isaac Munson and he is fantastic. Thank you for putting that up there, Catherine. Where was I going? I just totally lost my thought in the middle of a sentence with how many hundreds of people on the phone. From a conflict resolution standpoint, there's nothing wrong with reaching out to human resources of a vendor. In fact, I would tell you that's exactly what you need to do. I have so many examples in my career of third-party vendor employees inappropriately speaking to or hitting on or treating my clients' employees, and the first phone call we make is to human resources. Mm-hmm. At the end of the day, it's sort of like the old adage around if you're ever held up at work, you do what they ask and you give them the money and you say goodbye. And it's the same here. This is not a battle worth picking in today's times. Mm-hmm. So if somebody refuses to wear a mask, it's not a fight worth picking, but the follow-up, giving them a no trespass, they can't return to your property, calling human resources, decommissioning them as a volunteer, but future state eliminating the opportunity for them to return, I think is especially important.
Okay, that's good. That's interesting. Well, let's move to topic 3, which is virtual to in-person work and leadership. Over 75% of our survey participants said their nonprofit utilizes a hybrid model or allows employees to choose their schedules. So for nonprofits who hired employees during the pandemic and have spent those folks have spent most of their time working virtually, if not all. What suggestions do you have to ensure that they feel welcomed and included when they start back to in-person work?
So lots of comments here. I want to sort of lay some contextual groundwork or foundation here. The recruitment and retention environment that we're operating in today is unlike no other we've ever seen. So I was a headhunter and recruiter once in my life in the late 90s. I made a ton of money during a previous labor crisis at the end of at the late 90s, recruiting and identifying talent for organizations. And the labor shortage we saw then was romper room compared to what we're seeing today. There isn't an industry, a job, a sector, a geographic area that isn't dying on the vine for talent. Manufacturing, healthcare, hospitality, tech, lawyers. Who would ever have thought we have a shortage of lawyers? We have a shortage of lawyers in this country. I mean, every industry, financial, accounting, CPAs, I don't know what's happened. I don't know where all these people have gone, but we have a major shortage in talent. And so this question is so incredibly important, because if your employees don't feel safe, don't feel comfortable, don't feel like they can come back to the workspace, or don't want to, they'll quit because there's 10 other jobs for them. And in nonprofit, it's even more challenging because people are in nonprofit much more for altruistic, integrity, personal heart drive, fire in the belly kinds of reasons than they are for anything else. They're certainly not in it to make gazillions of dollars and ultimately retire with wealth and Mercedes and pools and boats. And that's what happens when you win the lottery, which I'm counting on someday. But anyway, so, you know, you talk about what's going to make somebody feel comfortable coming to work, Terry. And I think that has to be a holistic conversation. I know today we're talking about COVID, but we're talking about diversity and inclusion. We're talking about personal, emotional, intellectual, and physical safety in the workplace. Do you have a work environment where people feel safe? And I don't just mean safe from COVID or safe from discrimination or harassment or those sorts of employment related things, but safe to disagree, safe to have new ideas, safe to want to pursue a career in your organization that might be different or ambitious or driven. There's all kinds of safety that occurs in the workplace. And have you created an environment that welcomes people back that includes all of those components of workplace safety, not just violence or COVID? I think the other part is being able to be sensitive to how difficult this transition is going to be mentally, emotionally, and logistically. I've been home for 16 months, I think. Before COVID, I was on the road 46 to 48 weeks of the year. And my first 90 days to 6 months are a blur. And B, boy, was it hard. Like, I put my suitcase away and it gathered dust. That hasn't happened in 10 years, right? And then I finally adjusted, and my cat really likes me being home. Like, I'm happy kind of being home. And I just got back on the road 3 months ago, and I am not gonna lie, it is an adjustment. It is difficult. And you're talking to a person who I love to travel. I love getting out and seeing you guys and sitting in your offices and bonding and helping and supporting. So my passion was being out, and I'm having trouble getting back to it. So I can't imagine how hard it's going to be with people with children and pets and new lifestyles. The dog adoption rate during COVID was the highest it's ever been. So people have adopted and adapted to being home. Are you going to be flexible and sensitive to what we're asking of employees to do? We're asking them to reverse engineer an entire lifestyle that they have built around being able to be home and be flexible. And I think those things are absolutely key in bringing people back and retaining your talent, because there are lots of employers out there who are absolutely willing to let people stay at home and work from home.
So
Does that help? Is that responsive?
I think absolutely, and I think you speak to the it's two pronged, probably 3 or 4 or 5 pronged, but we've got to keep morale up on the team, and I mean, adjusting our schedules, just budgeting time for if we're going in 2 days even, but let's say all the days. I know we used to figure out a way to get our dry cleaning and the commute and packing our lunches and getting the kids out the door today, all the things I did it every day without even blinking and thinking about it. But now it's different, and I'm going in a couple days a week, but boy, the stuff I have to carry, and because I always, anyway, long story short, long story, I will not talk about myself. But so what are some ideas about how do you guys have any thoughts on how we help maintain balance? What are some strategies creative strategies that you've seen employers do that we might be able to use in our sector? I know some of them are probably going to be expensive, but this might be a time to buy lunch every now and then, things that we wouldn't necessarily do. Rob, it looks like you've got some ideas on this.
Yeah, and I've mentioned this idea to a number of people on the call, and it's always one like, this is great, and it's super easy though. But when I went back to church for the first time, they were handing out bracelets, and they were red, yellow, and green. The red bracelets were stop. The yellow bracelets were like, hey, I'm cautious, but somewhat approachable. And the green bracelets were, on the side of them, they said, handshakes and hugs, welcome. So, I mean, something even as simple as understanding where somebody is without having to ask them the question. I mean, so you'll have all the people wearing the greens, and they'll see them, and you'll see them because they'll be hugging each other and high-fiving. But it also respects the yellow, the cautious, and then the red, kind of I need to be on my own. So that was one creative idea that I think has been super helpful.
And I love that because it gets away from the vaccine conversation and the COVID conversation. I will tell you that I was really caught off guard, and I like to believe there isn't a lot that catches me off guard, but I might live in a bubble. I might admit that. But I went back to work, and I was at a prospect meeting in another town, and we all sat down to break bread and have coffee, and it was just lovely to all be together again. And have you had COVID? Are you vaccinated? Have you been sick with it? Why are you wearing a mask? I mean, the kinds of invasive conversations that have become part of our everyday vernacular was stunning to me. But these conversations around private medical information and your health status, and if you've had COVID or if you're vaccinated, I mean, that you got to address COVID etiquette. What kinds of conversations are appropriate and not appropriate, because people don't necessarily have the same appetite to talk about their private health information. Would you sit down with somebody and say, so do you have high blood pressure? Have you ever had cancer? It's not any different, but I think we've been desensitized to that. And I'm just as, it took me a minute to realize, wait a minute, I got to put on my professional hat. This isn't okay. I think a couple of other ideas I have are, office delivery and pickup of dry cleaning, office delivery of food, people being able to grocery shop online if they're comfortable doing that, and having the food delivered to the office and having a refrigerator where they can store it until they get home. Flexible schedules, hybrid arrangements, and not just 2 days in and 3 days out, but on those days in, can they come in a little bit later and leave a little bit earlier because of errands that they're used to running or school drop-off activities that they're now used to doing, but being flexible with employees. And I would really recommend that you memorialize those arrangements in writing. At Hub, we have a form, and we're allowing hybrid arrangements and flexible arrangements, but the manager maps it out on a form where everybody signs off and agrees. And I understand I'm employed at will, and these are the work hours and the days that you expect me in the office, because you have attendance policies that you need to enforce and behavioral expectations that need to be applied consistently across the board.
I did one more thing. One thing we did locally was we just had a picnic. Oh, I think Rob was even there. I think he showed up. But we just had a picnic at the local office, and they brought a snow cone truck out. I mean, just great for morale building, you know. And just there was people that had got hired during COVID. We'd never, I never met them, even though they live maybe right down the road, you know. So that was helpful.
Sure, that's great. So I think we'll move to questions. Or do we have questions in the chat, Catherine?
I don't have anything added just yet, but Emma just asked, Carrie, can you share the work arrangement form that you mentioned?
Yes, I will sanitize it. It was written specifically for Hub, but that's a great idea. I can make that more of a generic kind of document that you.
That would be terrific. That would be terrific. I guess in a follow-up to the flexible, we have, some of us have always had, some of us have recently developed remote working policies and in our handbooks. And if you look at the remote working policies, of course, they weren't, most of them written, they were written before we had COVID. And they're sort of rigid, like how often, who can do it. And so I think I'm guessing that you're going to say we need to relax some of that rigidity in order to have flexibility and allow more employee choice that may work. How do we have expectations, but also allow the flexibility and make sure that does it need to be the same for everyone, right?
It's a great question. And so the thing that you'll always hear me say, and any employment lawyer or HR person will say this as well, you have to be consistent. It can't appear that you're handpicking and allowing one person to do that the other person can't do. If they're similarly situated and it works for them both, then you have to afford the same opportunities. Now, that doesn't mean that everybody gets the same exact schedule. If Sally Sue says, my 3-year-old's making me crazy, I can't wait to drop her off at daycare and come back into the office. I am done with being at home. I'm managing dogs and cats and children and husbands and doorbells and FedEx deliveries and landscapers, and I'm out. Versus Bob, who may say, you know, I've become primary caregiver of my kids. I really need to be at home more. That's fine that they're negotiating their work arrangements. It's not a lot different than negotiating work arrangements when you're first hired. Whatever you do, you want to enforce it consistently. You want to revisit consistently. You want to memorialize it consistently. And to the extent that you're going to put up guardrails or limitations, the limitations are applied consistently. So if your policy is no one, regardless of role, may work from home more than 2 days a week, don't start making exceptions on a hand select basis. Make exceptions for people as an accommodation under ADA, sure, that's legitimate, that makes sense. Make an exception for somebody under FMLA for intermittent leave if you're large enough to be subject to FMLA, sure, that makes sense. But don't do for one that you're not prepared to do for all.
That's great. Grace had a question in the chat about did we answer your question, Grace?
Grace, I would say that any person who has an alternate work environment or schedule should be memorialized, because you have to anticipate that later someone's not going to show up on time. Somebody may start taking advantage of the arrangement. You know, for those of you who are subject to FMLA or have administered FMLA in the past, we all know that intermittent leave is the #1 most abused federal right afforded to employees, because they feel like, well, I'm on FMLA and I'm protected and you can't do anything. And they take advantage. And what we don't want is that kind of mentality to start applying in hybrid work environments. So everybody gets literally gets on the same page and agrees and understands what the work rules are. The last thing I want to say, I know we have 2 minutes, but very quickly, and Rob, you might want to chime in, is for those of you who have dramatically shifted to a work from home environment, we want to make sure that your work comp carrier is up to speed and aware, and that you've got some good controls and rules around the workspace. So a dedicated office, clarity that, you know, tripping over the dog or the laundry basket is not going to be compensable. So I think it's important that for those of you who have clients, connect with Rob. For those of you who aren't, connect with Rob. And also make sure that your comp carrier knows that you've got people who are working from home, because we don't want them to deny a claim because they rated you on in-office work and versus remote work.
That is really, really important. Really important. Thank you for reminding us about that. Well, we are about ready to wrap up here. This hour has gone so fast, and it's been chock full of so much great information. And I think there's so many things, so many questions that we will all have in our heads afterwards. So you've prompted us to think in new ways for sure. So thank you, Carrie, Rob, and Shannon for being with us. We are going to have another town hall on Thursday, August 26th. It will be at 3 o'clock. And we'll get that topic out to you next week, maybe even in that follow-up email that you'll get from Catherine. We're combing through our needs assessment to see what would be the latest and greatest hot thing we can bring to you. So thanks to everybody in the community for tuning in, and big hand for Rob, Shannon, and Carrie. Thank you. And also to Catherine for managing all of the many, many things in the research. Catherine, thank you so much. Have a great afternoon, everybody.